Hi, my name is Katie Myers. I am a student at Valdosta State University in the class of Medicinal Chemistry, and I'm going to be taking a closer look at the details, causes, and treatment of obesity around the world. According to the World Health Organization, obesity is defined as abnormal or excessive fat accumulation that may impair one's health. Since the 1980s, this chronic disease has nearly doubled worldwide, causing the World Health Organization to declare it a global epidemic and a worldwide public health crisis that is taking the world by storm and causing millions to have significant medical consequences. In the world today, 1.4 billion people are estimated to be overweight, and at least 2.8 million adults die each year as a result of being overweight or obese. Mexico has recently surpassed the United States as the most obese country in the world. Even though Mexico and the United States differ by a small 1%, the reasoning behind the obesity is quite diverse.
Mexico, having surpassed the United States in obesity, takes the top spot as the most obese country in the world. According to Mexico's National Council of Social Development, 45.5% of Mexico's population are living in poverty, which causes their traditional diet to be based on beans, rice, and corn because it is inexpensive to grow. Traditions and customs also play an important role in the Mexican diet by celebrating holidays and customs with food. Mexico's obese population is growing at an alarming rate and continues to lack of a healthy lifestyle. The United States falls under 1% behind Mexico as the second most obese country in the world. With Americans' multitasking lifestyle, their diet is mainly based on fast food, which is the hub of refined and processed food. With the combination of poor diet and increasing inactive lifestyles, the United States is a ticking time bomb of obesity. When a person is obese, it does not necessarily mean that they eat too much. Yes, eating too much is one cause of obesity, but there are often other answers. Obesity can occur from a combination of many different factors. The main factors include an inactive lifestyle, like an energy balance, health conditions, genes and family history, and a poor diet. Most of these factors differ all over the world by the region or culture you live in. The most common way to classify one's weight is to calculate your body mass index, also known as your BMI. Your BMI is a rough guide to classify your weight, and although it has its limitations, it provides the most useful population level measure of overweight and obesity for both sexes and for all ages of adults. You can calculate your BMI by dividing your mass by the square of your height, and then you would look on the chart and classify your weight. There are many different charts that you can choose from to evaluate your BMI that range from countries to gender. According to the World Health Organization, if your BMI is greater than or equal to 25, it is considered overweight. And if your BMI is greater than or equal to 30, you are considered to be obese. According to the World Health Organization, heart disease is the most common risk factor associated with obesity. Heart disease, also known as cardiovascular disease, develops when a substance called plaque builds up in the walls of the arteries. Plaque buildup narrows the arteries and makes it harder for blood to flow. The second most common risk factor of obesity is type 2 diabetes. Type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar. Your body either resists the effects of insulin or doesn't produce enough insulin to maintain normal glucose level. Other serious common risks of obesity include cancer, high blood pressure, sleep apnea, and GERD. When normal diet and exercise alone cannot stop obesity from occurring, doctors often prescribe medication to prevent obesity and in turn lowering the medical risk associated with obesity. Lorcaserin, also known as Belvic, is a selective 5-HT2C receptor agonist that helps to regulate appetite, mood, and endocrine secretion. According to a study conducted by Arena Pharmaceuticals, combining lorcaserin with a reduced calorie diet and regular exercise is suggested for treating obese patients with a BMI of 30 or more and in the presence of at least one weight-related risk factor such as hypertension, dyslipidemia, cardiovascular disease, glucose intolerance, and sleep apnea. The recommended clinical dose of lorcaserin is 10 milligrams twice daily, and the intended patient population is adults aged 18 years or older. Its common side effects include fast heartbeat, dizziness, anxiety, and muscle ache. Its mechanism of action is currently unknown. Phentermine, also known as Atipex, is a psychostimulant drug that is used for the short-term treatment of obesity. It is an amphetamine that stimulates neurons to release or maintain high levels of a particular group known as catecholamines. Its targeted audience is people who are significantly obese, and diet and exercise alone are producing minimal results. According to an assessment done by the United States Food and Drug Administration, the recommended dosage for an individual that is 13 years or older is between 7.5 and 15 milligrams taken once daily. Many studies have shown that the effectiveness of phentermine tend to wear off as time goes by. Its side effects include insomnia, dry mouth, constipation, restlessness, euphoria, nervousness, increased pulse rate, and blood pressure. Metformin, also known as glucophage, is an anti-diabetic drug that is prescribed to individuals that are obese or overweight and have type 2 diabetes. It is a popular first drug of choice for many doctors across the world. In a study conducted by Solvay Pharmaceuticals, metformin has been shown to reduce weight gain, hyperglycemia in adults with type 2 diabetes, and progression from impaired glucose tolerance to diabetes in those without diabetes. Metformin's molecular mechanism of action is still unclear, but there have been many proposed mechanisms that are currently being scrutinized. Even though metformin is mainly a diabetic-related drug, recent studies have shown promising results as a short-term weight loss drug for children. Metformin's common side effects include headaches, diarrhea, nausea, and swelling of the abdomen. Although the future of obesity worldwide is largely uncertain, we do know that there are ongoing effects to containing this chronic disease. Since obesity is a fairly new global health issue, there is currently a limiting supply of anti-obesity drugs. The research to develop more anti-obesity drugs has skyrocketed around the world and has been progressing towards many new drugs. Countries like the United States, England, and Asia have been the top countries that are currently producing new mechanisms toward these types of drugs. The future of obesity is looking